Hi, and welcome everyone. Thank you for giving us this opportunity. My name is Husna, and this is my colleague Lily. We work in Arbeiter-Samariter-Bund, Indonesia and the Philippines. Last year, our organization commenced a research to examine disability and older age inclusion in Central Sulawesi Emergency Water Sanitation and Hygiene or WASH. This research is funded by ELRA's Humanitarian Innovation Fund and conducted in partnership with Center for Health Policy Management of Gajah Mada University and the Working Group of Organizations of People with Disabilities, or the OPDs, in Central Sulawesi, Indonesia. The members of the OPDs also participated as the co-researchers who were responsible for data collection and dissemination process. In this presentation, we will introduce our research project and its findings. We will also highlight some key takeaways from our research regarding the barriers and opportunities of making humanitarian WASH programming more inclusive. But first, let me explain why we undertook this study. We know that WASH is a priority in humanitarian action. Adequate provision of WASH is proven to reduce the vulnerability of affected populations and reducing environmental health risks. Nevertheless, the most at-risk groups, including older people and people with disabilities, are often left behind in humanitarian action and in the provision of WASH. International humanitarian standards, including the Core Humanitarian Standards, or CHS, sphere, and the Humanitarian Inclusion Standards for Older People and People with Disabilities, or HIS, provide guidance for inclusive humanitarian action. Despite these existing standards and guidance, the inclusion of older people and people with disabilities in WASH practices remains limited, as indicated by the ELRA's WASH Rapid Review in 2019. Further, there is a limited understanding on what are the underlying factors or root causes contributing to WASH actors' difficulties to ensure inclusion in their programming. Based on this, our research sought to answer three main questions. First, what are the barriers to inclusion in emergency WASH as experienced by older people and people with disabilities in Central Sulawesi? Second, to what extent the WASH actors address the barriers to inclusion throughout the project cycles? And the third, what are the gaps and opportunities of enabling inclusive WASH based on humanitarian inclusion standards for older people and people with disabilities? To answer these questions, we conducted this research in 9 villages in Central Sulawesi affected by disaster. Our research subjects consist of two categories. First, there are a total of 59 informants from the category of older people with functioning difficulties, and people with disabilities. Second, we conducted online survey to 26 WASH actors that provided WASH services in Central Sulawesi to get an initial assessment on how their inclusion practices look like. And then we conducted semi-structured interviews to 9 WASH actors who were chosen by a purposive sampling to get an in-depth understanding of their practices. To assist our analysis, we used the Humanitarian Inclusion Standards for Older People and People with Disabilities, or HIS, as a basis for an analytical framework. The HIS are based on the core humanitarian standards and provide guidance on how to deliver inclusive humanitarian programming by placing older people and people with disabilities at the center of interventions. We will use 9 key inclusion standards of the HIS and 3 WASH inclusion standards to present our findings for both categories of informants. Over to you, Lily.
Thank you, Husna. Okay, let me first begin with the older people and people with disabilities category. First, on identification, there were no older people and people with disabilities who reported that they had been contacted by humanitarian agencies for identification purposes. They also did not participate in any surveys or needs assessment after the disaster. Second, on safe and equitable access, some informants reported that they did receive WASH services such as hygiene kits, drinking water, and installations of toilets and clear water source. However, they noted that they had difficulties in accessing those services. For instance, there were no specific assistance, no separate queues provided for older people and people with disabilities, and toilets and water sources were also located far away from their homes and also are inaccessible. Third, on knowledge and participation. The majority of older people and people with disabilities reported that they were not consulted in the design and delivery of WASH services. But there were a few minor exceptions. One older man with disability reported that he was being consulted in determining the location of a public water point. But this informant was considered as an elder with social standing in his community, so perhaps that was the reason why he was being consulted. And there were also 4 older men without disabilities who took part in the construction and maintenance of latrines and water storage in their villages. Lastly, on feedback and complaints. Older people and people with disabilities reported that they did not know whether their feedback was expected. And overall, there was also a lack of awareness from informants that they had a right to provide feedback. Now I'm moving on to the findings from the WASH actors informants. First, also regarding identification. 70% of WASH respondents reported that they did not identify older people association or organizations of people with disabilities during their post-disaster assessments. The WASH joint assessments also did not gather information regarding disaster impacts and the specific needs of older people and people with disabilities. Second, regarding access, the majority of interview informants reported that WASH services were provided for the general population without adjustment to ensure safe and equitable access for older people and people with disabilities. There was a focus on tangible items or hardware components of WASH in the examples provided by WASH actors when talking about inclusive WASH. Often, examples given were about toilets or water points that are physically accessible. Only one of the WASH actors interviewed talked about the important principles of inclusion alongside physical accessibility, such as meaningful participation of older people and people with disabilities. Third, findings related to knowledge and participation. We found that there were no capacity building provided to older people and people with disabilities to enable their effective participation. There were also no measures to promote their direct participation in WASH coordination mechanism. And there was a concern that including older people and people with disabilities could add to their burden when they're already facing a lot of difficulties after the disaster. And fourth, findings related to feedback and complaints. Having feedback mechanism in place is not that common, and out of 3 WASH organizations that did have feedback mechanism, there were no organizations specifically targeting older people and people with disabilities. One WASH informant assumed that community members, including older people and people with disabilities, will feel uneasy providing feedback because they have received assistance. In comparison, as I have explained previously, older people and people with disabilities assumed that their feedback was not expected. Fifth, on coordination and learning, the majority of WASH respondents reported that they did not partner with disability and older age organizations in the delivery and planning of their WASH interventions. Since there were very limited practice of collaborations, There were very little documentation of learning on inclusion by WAS actors. This could be because inclusion is often considered as an add-on, where it was only considered if it was required by the donor, as noted by one of our informants. And lastly, on resource management. There was a perception that addressing inclusion is mainly the responsibility of organizations that are specialized in inclusion and may be better resourced to do so. Majority of WAS informants felt that they have limited time and resource to ensure inclusion in humanitarian. It was noted that in short-term humanitarian work, the emphasis was on life-saving, and there was no time to ensure inclusion compared to the longer-term WAS development projects. So far, I have presented the findings that indicate the barriers to inclusive WAS. But despite these barriers, our research also found some opportunities for inclusive WAS. I will hand over to Husna to share this as a closing to our presentation. Over to you, Husna.
Yeah, thank you, Lily. There were indeed some opportunities that we identified. First, there were a few good practices of disability and older age inclusion led by specialized organizations focusing on disability and older age. These good practices provide a basis that can be built on and replicated. Second, we also found that all the donor agencies' informants have their own guidelines on inclusion and even specifically on addressing inclusion in WASH. WASH actors reported that they would implement inclusion initiatives if it was a requirement of donors, but this was not always the case. Therefore, donors need to introduce compulsory reporting requirements on disability and older age inclusion. Third, older people and people with disabilities in communities also indicated a willingness to support the response and to be involved in consultations if the opportunities and support were made available. The joint needs assessment was an example where they could have participated and provided inputs. But this requires a change in mindset from focusing on older people and people with disabilities vulnerabilities to recognizing their capacities. And finally, also there was a tendency for informants to consider inclusion to fall within the remit of specialized organizations. There were signs WASH actors are moving towards being more inclusive of older people and people with disabilities. Making sure that inclusion is institutionalized and mainstreamed alongside more targeted interventions are opportunities that we should maximize for a more inclusive WASH. I will end our presentation here, but if you have any comments and questions, please do let us know in the live question and answer session. Thank you.